Good morning, everybody. And today's an extraordinary announcement. When you work together in a partnership, you can do extraordinary things. And I want to thank my partner from the other side of the river, Steve McLaughlin, for being here, county executive. And the reason why we're here too is a couple great announcements. We're standing here with Health Insurance Solutions Incorporated that are here with us to explain a few things. But on a national level, Steve and I belong to County Executives America and to NACO, and we got to meet this extraordinary company. And you can either think outside the box and look at how to save money across the board, or you could just continue on with government. And sometimes it's hard when you're trying to find money, you're trying to save things, keep the same quality policies that we have in place, insurances we have in place, don't change anything, don't disrupt the workers, don't disrupt the healthcare, don't make the unions upset. It gets difficult. And here in Albany County, we have 20 unions. Think about that. Roughly around 2,800 workers. And when you sit there and you try to fix everything and you try to say, hey, look, nothing's going to change. We're not going to disrupt anything. But here's what we're going to do. So with county executives, this company came in, Nanette and Chris, and with Ed Cavney, I think it is, from county executives, that nice-looking gentleman in the front row, right, with the tie on, and explained this whole model to us of how to look at insurance. And, you know, I just want to back up a little bit, because one of the things that when we took on the healthcare industry, the pharmaceuticals, on county executive side, we did an MDL. We fought them all the way through court. We got one of the first settlements on a national level, and people said it wasn't possible. We were the smallest county at the table, and the judge Polster at the time was like, "How the hell did you get here? And you're the smallest one. You're leading the charge," because we don't back down. When we see something that can save money and makes common sense, we move forward. So from that moment on, when I looked at that, I go, man, we really got to do a deep dive. And I said, it's like being a goldfish with piranhas or sharks. You go in against these healthcare insurances, and you're fighting. They're coming in, they're prepared, they do their homework, they run circles around you. Their lobbyists run circles around you. The PBMs run circles around you that are supposed to be watching your back. And you look at the whole thing. 5 years ago, I was spending roughly almost $20 million on prescription drug, and they came in, they go, we're gonna look at your top 10, just your top 10 drugs. You think I was trying to burn a building down, right? You think I was trying to like disrupt everyone's lives. From that moment on, we only spend today like roughly $9.8 million. We trended down in the last 5 years with just, you've seen us here before with the rebate checks, you've seen us here before doing presentations, talking about the savings, and that got into the next fight. Because I guess Steve and I do like fights, and we like going back at people and saying, hey, look, you know, we're not always right, but we're going to try to do something differently and not look at the way government is as of today. We have looked at everything that we did wrong, fixed it, things we did right, we're doing better, because we brought the right people in. We brought the Health Insurance Solution Incorporated here to sit at the table with us, to help us figure this out, to navigate this big system. And it's a relief to the taxpayers, as Steve has successfully in Rensselaer County, as I have successfully here in Albany County, kept taxes down for 11 years, and not knowing what our lives are going to look like when this is all over with, when this budget passes, or especially in 2027, I have an obligation to be ready, to say I have done everything. And if we want to continue to do no tax increases, we want to continue to improve our services, deliver our services, we need them. You have an obligation to look at it.
We brought transparency to benefits for the county. We have brought in new technology, so we're streamlining the process. We also, payment integrity, and that's really Chris. We talk about auditing, and that's really making sure that what's coming in is real, and hospitals and facilities and doctors and the prescription part of it are not just, putting in dollars that need to be paid and they're not accurate. So that's really key for us, that payment integrity.
Congratulations to Dan and the Albany County Legislature and to the taxpayers of Albany County and the workforce of Albany County. Dan and I learn a lot from each other. We belong to things like New York State Association of Counties, County Execs of America, National Association of Counties. We learn from those organizations and we bring home, we're always looking for best practices. Who can we model? Who's doing things right? We've done some unique things in Rensselaer County. This is unique. We are behind Albany County right now, but hopefully enacting the same agreement.
We're very fortunate that we have a county executive who has and is president of that National Association of County Executives. And since he has been a member of that, he has been able to bring back information in regards to resources that are out there that have benefited Albany County. As I listened to Mr. McLaughlin talk about the different things that go on behind, closed doors and the conversations, about Tier 6 and so forth and so on, those are things that many people do not pay attention to. But that combined with all of the issues that confront the counties today, such as we don't know and we're uncertain as to how the feds or the state is going to continue funding for certain programs. So again, I just want to thank you for all the hard work that you do and how you employ it, and for finding this great organization here that's going to be able to save us all of this money, and just keep up the good work. Thank you.
But I do want to say thank you to Nanette and her team, and to Ed and his team, and to everyone in Steve's leadership on the national level with a lot of this stuff. It's not possible without working together. So I do want to say thank you, thank you, thank you, and I don't know if there's any questions from the press. All right, thank you.